Okay, we are live from Hilton Head, South Carolina. Hello to everybody. I'm Dr. Dekel. For those of you who see me for the first time, it's great to be with you, and thank you for joining us today. This is our second appearance, so to speak. Uh, Last appearance was delayed because of Easter Sunday, but from here on, we're going to be every 2 weeks. And again, thank you all for sharing this Sunday evening with us. We believe that we're going to share some very important information with you today, and that's the purpose of the channel. Unfortunately, we are against the tide of information. We strongly believe that there's a lot of misinformation out there. There's a lot of agenda that is being put forth by pharmaceuticals and big interest of conventional medicine. And we do understand we're a small voice, but I believe that patients and people in general should have the opportunity to listen to opposing ideas and opinions, especially since they're based in science. So we actually need your help. We need your help to promote this channel. If you like the information that you're receiving, I know it's going to be a small step for you to click on like or share or comment. If you have any questions, there's a good time to put it in. And that will help us a lot. It'll help us to actually promote the information and really open the dialogue uh, because our job is really to inform the people, inform about questions that you have, about issues that you have, especially since uh, this last pandemic, et cetera. It's my understanding that it's almost impossible to get a doctor to talk to, not long to see, and the waiting is absolutely incredible. So any information that we give you, we hope will help. And again, we're open to calls, etc. So feel free. This is really a free information flow on both sides because um, I do learn from my patients, and especially their success. And allows me to actually see that the approach that I do is actually the right one. So last time, we actually surveyed our people and asked you, well, what would you like to do? Or what would you like to hear about? And there was a winner. The winner is we want to hear about hormones. We want to hear about hormones. And why? Because most patients that I see, I will complain about the following: fatigue, okay, insomnia, mood swings, inability to concentrate, memory with memory with memory problem, gut problem, okay. Energy is a number one issue. Again, when we talk about going into menopause or andropause, let's not forget the men, because men also lose hormones, especially testosterone, with age, actually to the tune of about 1 to 2% per year from the age of 25. So this is really a across the board issue for men and women, and actually young men and women too. This is not just for the crowd over 50, because I do see a lot of young patients with hormones issue. So let's start with the basic. What is a hormone? Well, a hormone is really a protein, and a protein is made of amino acids. So it's a various configuration of amino acids that actually are messengers. Okay, hormones actually create a response, a result, a action, etc. So we have what we call the endocrine system. The endocrine system is the system of glands that produces hormones. I'll give you a few examples of what glands are part of this system. All of these glands are probably known to you. You've heard about the thyroid, you've heard about the adrenal, okay? We've heard about the testes, the ovaries, the pituitary, okay? And there's some others that, for lack of better words, are not as important, but again, worth mentioning, okay? So let's start with one of what I believe is the most important one, which is The thyroid. Okay, thyroid is a small gland right around here, around your neck. Looks like a little butterfly, not a big gland. And it makes some very, very important hormones. It makes the T3, okay, T4, reverse T3. And the importance is that thyroid hormones tell every cell in the body how much energy to make. Well, obviously, if we don't have the right amount of hormones, or if the hormones, those proteins, are not getting to the receptor sites, the listening station to the hormones, we're just not going to have enough energy. The contrary to that, if we have too much, we also have a problem. Okay. So, how does this whole thing work? Okay. Well, I mentioned the pituitary before. The pituitary is a small gland at the base of the brain. Okay. It's in charge of really, for lack of words, lack of better words, it's like the conductor. Okay. It actually hears, quote unquote, from everything in the body and also outside the body. Okay. It's like a CPU, central processing unit of the computer. And it decides according to various feedbacks of how much hormone someone needs. So you probably heard about a hormone called TSH. TSH stands for thyroid stimulating hormone. Thyroid stimulating hormone is coming from the pituitary, and you can really think about it almost like the accelerator of the car. Okay. Meaning what? I want to go faster. I need more TSH. I'm going too fast. I need less TSH. So TSH, like the name, thyroid stimulating hormone, goes to the pituitary, to the thyroid and tells it how much energy, how much hormone to make. Now, the thyroid makes a combination of hormones. Okay, we'll talk about two of them mainly today. One of them is T4, and you say, "What? Why four? What is the meaning of four?" T4 means that the thyroid thyroxine, which is the name of the hormone, actually contains 4 molecules of iodine. And that's important. I'll share with you why in this discussion. So it makes 80% T4 and 20% T3. T3 is what? We take one iodine away from the T4, and now we have T3. So you say, what's the difference? Well, the difference is that T4 is not an active hormone. T3 is the active hormone. Okay. So you say, well, why does it make 80% 4 and 20% T3? Why doesn't it make the opposite? Well, compare it to the following. Let's think of T3 like a nitroglycerin, okay, which is a very unstable explosive. Okay. So, of course, the body doesn't want to be exposed to this kind of explosive energy and maybe overabundance of energy and, of course, disease. So it makes only 20% of T3, but the rest, whatever is needed, is going to be converted to T3, and therefore we're supposed to have the right amount of energy, consistent, etc. The issue is that in order for us to convert T4 to T3, we need energy. We need energy, we need certain enzymes, we need certain minerals, etc., like selenium, cofactors, etc. And some people don't have the capacity to convert. And therefore, they come to see me because why? They have no energy. Let's bring something else into the mix. Okay. The adrenal glands work very closely with the thyroid. Okay. And the adrenal glands are small little glands about this size on the top of the kidneys. And what do? They are responsible for our stress response. These are the glands that saved us from the saber-toothed tiger when we ran away from it, or defend ourselves, or to actually catch a prey. Okay. Well, when we're stressed, one of the hormones that being produced, in addition to adrenaline, noradrenaline, is called cortisol. Well, if we're stressed continuously, which has been chronic stress, which a lot of us in today's age, so to speak, are, we have produced a lot of cortisol and it doesn't go down like it should. When the stress is over, cortisol should be going down. Well, if the cortisol is high all the time, cortisol actually prevent the conversion of T4 to T3. Actually, it promotes conversion of T4 to reverse T3, which is by its name, the reverse. In other words, the reverse T3 is actually an escape route for the body to prevent any too high of thyroid function, or therefore prevent hyperthyroidism. So again, if we have consistent stress, we're bound to have what? Less energy. Okay. So I find over the last 22 years that I journeyed into holistic medicine is that it is really an epidemic. And you say, well, what do you do with that? Number one, number two, how do you know that? I know it because most of my patients come to me complaining of lack of energy. And it's interesting, those who don't complain, and I always ask my patients, how's your energy? And when I hear the response, oh, it's not bad for my age, whatever the age is, I know for a fact it's not enough. It's just the fact that we are getting used to the fact that as we age, we're going to have less energy. So there's another issue of how do you diagnose it? How do you diagnose low thyroid or overactive thyroid? Well, believe it or not, for me, in holistic medicine, is by listening to my patient's story. And so what about doing some blood testing? Oh, sure, we can do that too, and we do. In fact, a lot of my patients come to me with blood testing recently done by another physician. And when I bring the possibility that the thyroid is malfunctioning, they say, wait a minute. I mean, we just had blood tests and everything is absolutely fine. And that's really true. But the sad truth is that 80% of patients who are manifesting or showing lab tests that are within the normal limits still have clinically evident underactive thyroid or hyperthyroid. Well, hyperthyroid is much less prevalent than underactive thyroid. Thank God for that, because it's not nice, quote unquote, to have hyperactive thyroid. But it is absolutely not nice to have underactive thyroid. And once this is diagnosed, and forget that, I'll give you some symptoms that you can relate to. Okay, number one is fatigue. Number two is what? Brain fog. Number three is constipation. Number four is what? Insomnia. Okay, high blood pressure. Okay, it's almost every disease in the book can be related to underactive thyroid. Depression is underactive thyroid. Okay, because why? We said in the beginning that the thyroid hormones speak to everybody, every cell in the body, and tells it how much energy to make. Well, if that's the case, if it's skewed or it's not getting the message, obviously we have a problem. So what do? Well, at that point, I would actually support the thyroid gland with certain nutritional products, including glandular when needed. And the good news is that within 2 weeks, they have more energy. In fact, I'm so certain of this outcome because I've done it for more than 20 years that I'll tell my patients that if they don't feel better within 2 weeks, I missed something. I don't like to miss anything. So I say, it's your duty to call me and let me know if within 2 weeks you don't feel better. So again, this is the main story about the thyroid. Okay. Another issue that I see a lot is patients come to me with already on medication. And the medication they're on usually are pharmaceutically derived. Okay. They usually levothyroxine, Synthroid, same thing. It's actually T4. okay, just a brand name. And they're still not having the right energy they're looking for. And I find that the reason for that is that conventional medicine, endocrinology, decide of how much medication patient needs is really depending on one hormone, TSH. As we said before, TSH is the accelerator. Well, the story goes usually like that. A patient goes to a conventional doctor. They find out, yes, the blood shows underactive thyroid. They put it on thyroxine, on T4 for whatever modality they use. And the patient is being seen again a month from then and say, well, how are you doing? I'm doing much better. Thank you. Okay. However, as they do the blood test to repeat just to see where they are, the doctor says to the patient, well, I'm happy you feel better, but I think I'm giving it too much. Why? Well, the TSH is too low. But I'm feeling fine. I think this is the right dose for me. Well, but the doctor, with their training and their experience, know otherwise, and they say, well, it's really dangerous for you to take too much medication, so I really, really need to lower it. Well, what what recourse do you have? None. Okay, so they bring it down for whatever percentage they think that will adjust the TSH where it's supposed to be according to their standards. And a month later or 2 months later, the patient comes back to the doctor, and guess what? The TSH is really where it's supposed to be. However, there's one little problem. They have no energy. So they have this discussion and say, listen, I have no energy. I'm depressed. I'm this, I'm that. No problem. I'll give you some medication for depression. Everything's going to be fine. But what about the energy? Let the body adjust to this, and you should be fine. Okay, and I'll see you back in 6 months. Well, when they don't get better, they look for another doctor. Now, unfortunately, if they see the conventional medicine, they're going to hear the same story. But once they start looking for holistic medicine practitioners, and they come to see me, via direct visits or telemedicine or Zoom, whatever, and we actually address the issue, and I actually give them the supplements that they need. And voila, they have what? They have more energy. So this is really a universal pitfall. It's very unfortunate because it's totally unnecessary. In fact, I can tell you categorically that in my experience over the last 2 decades, a patient that has enough energy because of thyroid support, their TSH, okay, will be too low for conventional medicine. So I asked the patient, what would you like better? You would like to have your TSH where it's supposed to be according to conventional medicine, or would you like to have the energy that you deserve? Well, obviously it's no brainer. It's no brainer, and patients realize. And I tell them right up front, I say, listen, if you show this TSH result to a conventional doctor, they're going to have they're going to be upset. Okay, so I encourage my patients to actually read about it. Okay, because my opinion is minority opinion. Okay, even though it works across the board, but still a minority opinion. So it's not a question of who you believe. You believe me, you believe the other doctor, or whatever. What you need to do is believe your body, how you react. But educate yourself. There's enough information out there. One great book that I recommend to everybody to read that has a thyroid issue is, it's kind of interesting name. It's called Stop the Thyroid Madness. Very good name, isn't it? And it was written by a non-doctor. It was written by a patient that got fed and sick and tired of not being helped. She started to do what? Research the subject, fixed herself, and wrote a book. Actually, she wrote a book by now. And that will actually give you a very good understanding of why the thyroid is such an issue. Even though it's been diagnosed, and still most patients don't feel right about it. So again, if you have any question about it, my partner, uh, Brandon, is actually monitoring our channel and is going to give me any questions that you may have. Do we have a question?
Yes, we do. We have one from WL Cocal. Says, "Good afternoon, Dr. Dekel. What causes a low iron saturation in the blood test results for men?"
Low iron saturation from?
Just says, "What causes a low iron saturation in a blood test result?"
Okay, that's a good question. Low iron saturation can be as a result of actually not enough iron. And in order for us to absorb iron, we need good stomach acid. Okay. We need to actually consume the right food, which is usually green leafy vegetable. Okay, it contains spinach, etc. It contains enough iron. So that's not the only thing I'm looking for. I'm looking for total iron. I'm looking for saturation, but looking also for ferritin. Ferritin is really the kind of the carrier of iron. I want to see if that's normal, etc. And also, I'm looking at the CBC and the complete blood count. I want to see if that low saturation is actually severe enough to actually create anemia. Okay, anemia due to what? Not enough iron. Okay, and if that's the case, uh, you know, in other words, I would tailor my response or my advice according to the entire gamut of not just saturation, but everything else, but also about the clinical presentation. In other words, you have fatigue. Okay. Also, a simple way to actually see if somebody's anemic is the old-fashioned way that nobody uses it. Is what? To do this. How red is it? If it's pale, it's most likely anemia. Again, it's an old-fashioned way, but it gives you a certain understanding until you get the blood test. Okay. But again, usually the fatigue, uh, most of the time is going to be related to the thyroid and the adrenal function. So what I would like to do now, I would like to move a little lateral to the adrenal. Okay, so as I said before, the adrenals are the stress gland. Okay, these are the ones that actually saved us over millennia to what? To get to today, because when we had any kind of stress, any kind of danger, these are the ones that actually, as I said before, pour in adrenaline, noradrenaline, and cortisol to do what? To increase heart rate, increase blood pressure, open the vessels, open the airways, open the pupils. In other words, to perceive danger and to fight danger. Okay. We say, well, wonderful. What can go wrong? Well, what can go wrong is the fact that the stress response back in antiquity was different than today. Today, we have response, we have stress the minute we open our eyes, or actually sometimes even during the night, where a lot of my patients have insomnia. What do you think is going on? The stress that we have during the waking hour is not being resolved because we're having a lifestyle that is not conducive to that, number one. Number two, there's not enough information being given to patients to say, okay, what do you need to do in order to allow the adrenal to do what? To regenerate itself, to repair itself. And that is really certain activities that actually gets down the stress level. Okay, and it can be via uh, meditation. It can be via certain slow breathing, certain mantras. Uh, I tell my patient before they go to sleep, say three simple mantras. Okay, number one, I forgive myself. You know, number two, I'm going to have a great night's sleep. You actually tell your body what kind of sleep you're going to have. And number three, which I feel is most important, is what? Tomorrow is another day. We carry our stress from day to day to day to the point that the cortisol is being manufactured on a regular basis to a high point. Well, cortisol is actually interfering with a lot of other mechanisms. We already mentioned one is the conversion of T4 to T3, and therefore interfering with what? With the energy level. Okay, but it also interferes with the immune system. It also interferes with bone density, and on and on and on. So what do we need to do in order to make sure that the adrenal is working fine, working well? Well, number one, obviously, is nutrition. Okay, we need to take good nutrition to support all the functions of the body, which is the adrenal is part of that. Okay, and also good night's sleep. The adrenals need at least 5 hours, five uninterrupted sleep in order to what? To regenerate themselves. Okay. How many of us wake in the middle of the night before 5 hours of being accomplished? A lot. A lot. They say, what do you do then? Well, we have natural remedies to help us sleep. One of my favorite is melatonin. I use melatonin spray because the spray gets absorbed sublingually under the tongue. I suggest the patient to actually take 10 sprays, hold it for a minute, and then swallow it. I suggest to take before you go to bed. Okay. That has been found to increase REM sleep, rapid eye movement sleep. That actually is the good sleep that regenerates the entire system. Okay. Now, what happens if you wake up in the middle of the night again? I tell you, use it again. You say, wait a minute, what about overdose or dependency or grogginess, etc.? Will I be able to hear my children, my kids, my small children, if they cry, they need me? The answer is absolutely yes. There's no grogginess. There's actually uh, no toxicity actually to melatonin. Okay, so you can actually overdose, which there's no need for that, but there's no problem with that. Also, melatonin is a very powerful antioxidant, so it prevents chronic inflammation. Also, was found to actually be anti-cancerous and anti-COVID. Okay, and melatonin, by the way, is another hormone. Hormone that's being secreted by a gland called the pineal gland. The pineal gland is actually a small little gland right here, about an inch and a half in. Okay, and that hormone, melatonin, being secreted when it's nighttime and it's dark, and this is very essential for sleep. Okay, you say, well, what's the percentage of people being helped by melatonin? The answer is about 80%. And I say, well, what about the other 20%? Another way of dealing with insomnia would be the CBD. Okay, I'm not talking about THC now. That's the more, uh, I would say, high part of the CBD plan. Uh, the regular CBD, but also with some other components, actually a little bit of melatonin, also valerian root, passion flower. All of these are very, very effective. Very effective. Looks like we have another question. No, we don't.
I was just trying to read the comment there that she replied back. I think she's trying to making sure that
Okay.
you saw her response.
Is it normal for a woman to experience her hair loss in the mid 30s? What advice do you have? Okay, that's a very good question. Thank you for that. No, a woman in the 30s should not lose hair. Okay, so again, it can be a definite byproduct of underactive thyroid. Okay, it can be nutrition. Okay, it can be stress. Uh, the uh, treatment for that would be what? Diagnose where it's coming from, and if it's thyroid related, fix the thyroid. But remember, I never just treat the thyroid. The thyroid is like a Siamese twins with the adrenal. If you just treat the thyroid, you're really not doing a good job. I need to support both the thyroid and the adrenal. When you do that, the hair loss will stop and you get regenerated. Okay, if you have certain nutrients that are missing, so we have supplements for that, uh, biotin and some other minerals, etc. That could be the reason also. Uh, but again, we need to evaluate the stress level. So to answer your question, no, it's not normal. Okay. Also, we find that some women post-COVID experience some hair loss, and men too, but mainly women. And that can also be reversible. Okay. But again, with the right nutrition and finding out actually what's the cause of it. Okay. Do we have any other comment? Okay, so that's good. Okay.
Yes.
All right. So we talked about the thyroid and we talked about the adrenal. And again, I encourage you to send comments, send questions, okay? Because we will answer it during the period of 2 weeks that we're not on the channel, okay? So you don't have to wait 2 weeks to get an answer. You're going to get an answer uh, within a short period of time,
I'll be
okay?
hoping making some videos to help answer the questions and
Okay, and we're going to make other videos to answer questions. Okay, so don't be shy about it. This is an open channel. You know, that's the whole idea about the channel is to do what? Answer questions. Okay, so let's see what else we're going to have here today. So let's go to a different section here, which is uh, the sex hormones, which are very important. Okay, so the sex hormone are considered to be estrogen, progesterone, of course, testosterone. Okay, these are the main three hormones, and they're being generated or being manufactured and produced by the ovaries. Okay, the ovaries produce estrogen, progesterone, and testosterone. Testes produce mainly testosterone. Okay, and unfortunately, as we age, and sometimes under different circumstances, those glands are not going to make the right amount of hormones, and or the right not the right ratio between those two hormones between the hormones. Okay, so let's go to the another gland that we mentioned before, which is the pituitary. And the pituitary is a small gland. It's almost like a pea size. Okay, it's right at the base of the brain. And as I said to you before, this is a conductor. So what do you mean by that? Well, the pituitary senses the level of hormones in our body. Okay, through another mechanism, the hypothalamus, and on and on and on. The thalamus. Bottom line is, it sends or produces hormones that control the other glands. We talked already TSH. TSH control what? Controls the thyroid. ACTH controls what? The adrenals. All right. Let's talk about the ovaries. There are two main hormones that control the ovaries, which is FSH, called uh, follicular stimulating hormone, and LH. LH stands for luteinizing hormone. So when you take the menstrual cycle, okay, uh, after a period is over with, okay, we have low estrogen on board, okay. The pituitary senses it and produces FSH. FSH, follicular stimulating hormone, goes to the ovary and tells it, okay, it's time to go to work. I need some estrogen. And then when you produce what? The follicle, the famous follicle, which is a cyst, okay. It grows up to about a golf ball size, okay, about 2.5 centimeters, about an inch in diameter. And that cyst, that follicle produces a lot of estrogen. And estrogen is a growth hormone. It tells the lining of the uterus to grow, okay, it tells the breast to get ready for pregnancy. And when it reaches a certain peak, the pituitary senses it. And then it produces another hormone called LH. Luteinizing hormones is responsible for what? Ovulation. It's the rupture of the cyst, releasing of the egg, and therefore you're fertile for about 24 hours. You say, why for 24 hours? Because that's the open window for fertilization for the egg. After that, it goes old, so to speak, and pregnancy does not occur. So what happens then is that the cyst that produces estrogen before is now going to convert to another type of cyst called luteal cyst. And luteal cyst makes a lot of progesterone. Okay, a little bit of estrogen still, but a lot of progesterone. The reason is that progesterone kind of contradicts, not contradicts, but balances is a better word. Balances the estrogen. It tells it, okay, wait a minute, stop stimulating growth of tissue, okay, and start maturing the tissue, especially in the uterus, to produce mucus, nutrients for the stability of a fertilized egg. Okay. In fact, the ratio of estrogen to progesterone at day 23, okay, of cycle, day 24 of cycle, is supposed to have about 200 times, 100 to 200 times more progesterone than estrogen. Okay. And then if pregnancy does not occur, both hormones go down, and then we have another cycle, another period, and then the cycle continues. Okay. So this is a beautiful orchestra. However, things can happen. For instance, after ovulation, not enough progesterone is being made. And in my experience over the last 40 years of medicine, low progesterone is a chronic and an issue that we find tremendous and really occurs too often. And actually happens with young women, teenagers. Okay, a teenager woman that menstruating but has irregular periods most likely because of lack of progesterone or not enough progesterone on board. It happens later on in the 30s, 40s, etc. And you find it by actually doing some blood tests. You can do saliva tests. You can do various tests to find out that this is the case. I actually listen to your symptoms, your complaints, and intuitively, I know that most likely it's going to be progesterone. I do also muscle testing called kinesiology, which is actually energetic testing. And when I confirm that this is the issue, I would prescribe natural, bioidentical progesterone. And usually I prescribe from day 14 to 28 because why? Because that's when the natural progesterone is being produced. And it's kind of very, very nice to see that a natural bioidentical hormone can change somebody's life of not having irregular periods, having too much pain, okay, mood swings, PMS, infertility, just name a few, okay, and all this can be taken care of by a natural hormone being prescribed for 2 weeks. Let's talk a little bit about bioidentical. What's the difference between bioidentical and conventional drugs? Well, for about 22 years as a conventional OBGYN, I used to give progesterone, but it wasn't really progesterone. It was a progestin. I didn't know the difference then. Okay, progestin is really progesterone being altered by pharmaceuticals to act like progesterone, but at that point they can actually write a patent on it and actually made it exclusive. Only later I learned that progestin is not progesterone. Bioidentical is the same molecule that the ovary makes, natural progesterone. The natural progesterone is made from living things, usually from the yams, and it's a metal convert. So I want to make sure that we don't think that yam cream is progesterone. No, it has to actually be converted, actually say that this is a progesterone. Okay. And it has no side effects. Okay. We have also a bioidentical that is made by Big Pharma, which also works. It's made in the lab. I personally believe that something made out of nature is more effective and more body friendly, so to speak. But it's really an incredible event to see that when any person that needs progesterone gets progesterone, how their life changes. As we go closer to the menopause, okay, we have to have fluctuation of the ratio between estrogen and progesterone. So anywhere between the age of 45 to 55, depending on genetic makeup, we may exhibit some issues. Women start to have what? Irregular periods, skip periods, too frequent periods, okay? Hot flashes, the famous hot flashes. Thank God not everybody has it. I would say 50% do and 50% don't, okay? In the beginning, how do we treat it? Well, actually, it's a lack of progesterone. Remember what I said? The first thing that goes down is progesterone, okay? So give progesterone, and that will probably hold you for a year or 2 years. As long as we find it's good for you, that's fine. Once we stop making estrogen, and we don't have the period for about a year, now you are considered in menopause. Okay. So now we're talking about bioidentical hormone replacement. And you say, is it dangerous? I hear that it increases breast cancer, uterine cancer, and other stuff. And you're right, as far as there's a lot of misinformation out there. Okay. And some uh, synthetic medication can increase the risk of cancer. But if you read the right information about bioidentical and the studies that were done about it, the conclusion, as far as I'm concerned, is the following. Women who take natural bioidentical hormones correctly, estrogen, progesterone, etc., will have less breast cancer and uterine cancer than women who take nothing. So I would like to take this information and really just kind of explore this for yourself. And I really, the fear of bioidentical hormone is really deep. And when I sense it in my patients, I don't push this. I say, listen, read one of the books I recommend. One of them is actually has a very interesting title. It's called Stay Young and Sexy with Hormone Replacement Therapy. And I say, read the book and then tell me what you want to do. Okay. And whatever you decide, it's okay with me. Why is it important? Osteoporosis increases when we go into menopause. Okay. Brain function. Without hormone replacement therapy, you actually expose yourself to more dementia, memory issues, etc. Heart, blood pressure. Okay. Uh, it really is a lifesaver for a lot of women. Okay. And those who don't want it, that's fine too. It's okay. I strongly believe and encourage my patients to listen to their body, educate themselves about whatever the case may be, and decide yes or no. And if they cannot decide, because most likely they need more information. And that's why we're here. Okay, I'm going to give you the best advice I know of. I have no problem if you challenge me, if you ask the questions until you feel that you are making the right decision for yourself. Okay. I would like to cover one more hormone before we kind of let you go, because it's a Sunday night. And let's not forget the men. Okay. Testosterone in men goes down 1 to 2% per year from the age of 25, as I mentioned before. And by the way, I want to mention also testosterone is very important for women too. And if testosterone is low, either we give you DHEA, which converts to testosterone, which is very important, also very important hormone, or we give you testosterone. Okay, smaller amount, obviously, than men. And we're talking about 1/100th of the amount that we give men. But it's a life changer for many women who need testosterone. So it's important for bone, it's important for libido, muscle mass, for both men and women. Okay. So I see a lot of men in my practice. Some of them are very young, in their 30s. Okay. And they complain about low libido, low stamina, not thinking right, not feeling like they are equipped to handle a day, so to speak. I asked them some questions. The simple question is the following: do you have a spontaneous erection in the morning? And if the answer is yes, well, most likely your testosterone is okay. But if you don't have an erection in the morning, most likely testosterone is low. And you say, wait a minute. What happened to blood testing? Can I tell by that? Yes, you can, and the but is the range of normal. Okay. Total testosterone normal is between 200 and 1200. So you're normal if you're 201, and you're normal if you're 1,199. You see what I'm talking about? And that's the problem. The problem is that we don't take a baseline for men in their 20s. So we don't know where you were. Were you at 1,100, 1,000, 600? So if we don't have a baseline, what can we count on? We can count on what? On symptoms. Okay. And when it sounds like your symptoms are directly related to low testosterone, and the lab actually shows that you're in, let's say, the low 30 percentile, that is something that you should consider. And again, for the man, I tell him, this is a powerful hormone like anything else. And like any other hormone, I don't subscribe to the notion that more is better. No. What we need to do is supplement it physiologically. In other words, get to the point that what? You were before, so you can function correctly and not overdo it. Okay? There are a few things that we need to follow up with patients who are taking testosterone. One of them is we need to check the CBC, the complete blood count, because testosterone stimulates the bone marrow to make more red blood cells, which is good in a way because oxygen carrying capacity increases. But if it increases over a certain amount, now we have to consider the blood gets sluggish, the heart workload is increased because of sluggishness of blood. And if that's the case, which is about 20-30% of men, then I recommend that you become very friendly with the Red Cross and donate a pint of blood once or twice a year, and that takes care of the problem. So some fear that men have is that testosterone is related to prostate cancer, and it's absolutely not the case. I actually recommend a book called Testosterone for Life by Dr. Morgenthaler, who's actually a conventional urologist who actually started the premise with the medical school axiom that testosterone causes cancer, prostate cancer, and he totally debunks it. Just think logically. If testosterone was causing prostate cancer, why don't men in the 20s and 30s with testosterone is off the chart get prostate cancer? Why do we get it when we're 60, 70, 80, or 90? Obviously, it's not most likely. It's actually estrogen related. Estrogen toxicity, and again, that's a different topic of cancer, and one of these days we're going to talk about cancer to dispel the myths of cancer and how to address it, how to mainly prevent it. But if we do get a diagnosis, at least you need to know what you can do about it holistically and pick and choose which direction you want to go. The beauty about giving testosterone to men is that within a month to 2 months, their life changes. So it's a major event. A couple of ways to take testosterone. One of them is via cream on a daily basis. Okay. And another one is via injections, which are done weekly. These are self-administered. I don't believe we should force the patients to come to the office every week or every 2 weeks or every month to get injections. By the way, a monthly injection of testosterone do just about nothing. I mean, you're going to feel better a week out of the 4. That doesn't make any sense whatsoever. But cream is very, very available and easy to do. So bottom line is explore your situation, see where you are, and don't take as my age as a reason to whatever you feel is not up to par with you. So bottom line is education. I think that we took enough of your time today. And again, we invite you to comment, ask questions, etc. And we'll see you in 2 weeks. Brenda, do you want to make any announcements?
Yeah, look out for our videos during the week. We've been just recording like crazy. So there's been a backlog of video editing that I've had to do. But a lot of them are finished now. So they're all dropping this week. You're starting to already see a bunch of them on our Facebook page. So if you go and visit our Facebook page, I'll go ahead and leave the link in the description below. I believe it's already in there. Just go ahead, go to the page, hit the video tab. You should see it under the More section. And yeah, check out all the playlists, all the stuff. Our new hydrofacial machine. We have a bunch of videos on that. We have a really huge beauty and aesthetics department that we're really pushing and wanting to show and show off all the wonderful equipment and things that we can do for all of our patients and potential patients out there that are looking for new skincare. And actually, Dr. Dekel just got a hydrofacial literally.
Oh, you're not supposed to talk
hours
about that.
right before he came on camera. So he's glowing.
Yeah,
Obviously, you can tell. This is me without a hydrofacial, one that just had a hydrofacial. Look at the glow.
It's pretty remarkable.
So, yeah,
I have to say. So I'm kind of addicted to it now.
Yeah.
It's really good.
Yeah. So looking forward to joining Team Dr. Dekel, just like everyone else is, and really help us join in the mission. The mission is the most important because together we can make an impact.
Agreed.
Separately, we're our voice is too small. We have to make an impact together. So thank all of you for those of you who tuned in, anyone who else that watches this, even if it's not live. Thank you. We're so grateful for all of your support. Just a simple like, a share, subscribe is just a small little click or anything to you, but to us, it is a huge impact because it allows us to spread a message of holistic healing and helpfulness and to impact and improve the quality of lives of people all around the world. That is what we want to do. So thank you all. Love to all. Have a good night.
Take care.